Hello, and thank you for joining today's NeedyMeds special topic webinar, Preparing for Your Doctor Appointment, presented by the Lupus Foundation of America. My name is Carla. I am the Director of Education and Partnerships with NeedyMeds. And before we get started, I want to go over a few tips so you can make the most out of today's presentation. First of all, if you have any questions, you can go ahead and type them anytime into the questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the time to answer your question, we'll follow up with you personally via email. And of course, we will provide the contact information for both the Lupus Foundation of America and NeedyMeds. This webinar is being recorded and will be available on the NeedyMeds YouTube channel. And you can find the PowerPoint slide decks accompanying this presentation in the handout section of your control panel. So let's get started with what is NeedyMeds. For those of you not familiar with us, what you are looking at on your screen is our mission statement, a vision statement, and a statement about how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. What you're looking at now is the homepage of our website, which is really the face of our organization. And as you can see, it is full of information, so I encourage you to browse the site when you have time. For now, I just want to point out a few resources. I was getting ahead of myself there, sorry. So if you are looking for healthcare savings programs, you'll want to begin your search with the Patient Savings tab. The Advocates tab right next to it is where you will find our educational information. You can sign up for webinars, our monthly newsletter Vitals, and order drug discount cards and other print materials. I mentioned that today's webinar is being recorded, and you will be able to find that recording on our YouTube channel, which you can find at the top right of our homepage with the rest of the other social media icons. It's the third one from the left. So let's get started with today's presentation and why you're all here. As you saw on the screen a moment ago, a big part of our mission is educating people. And we define education in two ways. One, by letting people know about NeedyMeds and the resources we offer, but two, by also educating people about other ways to stay healthy, which is why we are so pleased to have a partnership with and welcome a guest from the Lupus Foundation of America today. And our guest speaker from the Lupus Foundation of America is Ashley Holden. So first, let me tell you a little bit about the Lupus Foundation of America. They are the largest publicly supported lupus organization devoted to solving the mystery of lupus, one of the world's cruelest, most unpredictable, and devastating diseases. Through a comprehensive program of research, education, and advocacy, they lead the fight to improve the quality of life for all people affected by lupus. So now let me tell you a little bit about our guest, Ashley Holden. Ashley is the health educator at the Lupus Foundation of America's national office. Ashley received a Bachelor of Science degree in Public and Community Health from the University of Maryland and a Master of Education in Health Education from Pennsylvania State University. She is a nationally certified health education specialist from the National Commission for Health Education Credentialing. So as you can see, with her impressive resume and fantastic background, why we are so thrilled that Ashley is taking time out of her day to share her expertise with the NeedyMeds audience. And in particular, Ashley is going to provide, with this presentation, tips to make the most out of your next medical appointment. After all, the more prepared you are, the more likely you will be to discuss the issues that are most important to you, and the more likely you will be to leave with a plan in place. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Ashley. So bear with us while we do that. And as Ashley is taking over, I want to remind everybody that if you do have questions, again, you can submit them by typing them into that question section of your GoToWebinar control panel. And with that, I'll pass it to Ashley. Thanks.
Thank you so much, Carla. And I just want to make sure you can see my screen and everyone can see it before I proceed ahead.
thanks for double checking. As the audience can tell, we really like to do audio visual checks because we've learned from the past things can go wrong without us even knowing it. But yes, Ashley, we can hear you clearly and see your screen. Thanks for checking. Enjoy the webinar, everyone.
Thank you so much. Well, welcome everyone. Good afternoon or good morning, depending where you're attending from. And as Carla mentioned, I am one of the health educators with the Lupus Foundation of America. And, this presentation really is geared towards anyone that is preparing for a doctor's appointment, but a little bit about the Lupus Foundation of America before we jump into the meat of today's presentation. So the Lupus Foundation of America, or LFA, is where we envision a life without lupus. And we are dedicated to improving the quality of life for all people affected with lupus through research, education, and advocacy. And just a little bit about lupus awareness. I know that we'll be focusing on how to prepare for a doctor's appointment today. But like I said, I just wanted to briefly talk about lupus awareness. So low awareness, in particular about lupus or really any kind of autoimmune disease or condition, can result in late diagnosis. It may also cause further problems, complications, increased costs. And as you can see by some of these numbers on the screen, preparing before an appointment is crucial. In the case of lupus, most people will see at least 4 doctors before they receive a diagnosis. And sometimes it can even take 6 years to receive that lupus diagnosis. So again, just kind of stressing the importance of preparing for an appointment with using lupus as an example. And if you're interested, there are a lot of different ways you can get involved with the LFA. We have walks across the country. You can become an advocate, and there are a variety of different fundraising opportunities, such as Make Your Mark and other things that you can do with that. And we also encourage lupus patients to share their story with us as well, to really spread awareness of the disease. Some of our other programs and resources include our National Resource Center on Lupus, and that's our one-stop shop to find all the up-to-date resources and information on lupus. The website for that, you can always visit lupus.org, and you can explore our resources that we have. We also have what's called the Expert Series, and that's a monthly educational video series where you can hear presentations from leading lupus experts with a focus on helping people live well with lupus. We also have Lupus Connect, which is our online community where people can engage and connect with others, share experiences, find support, and even share practical insights for living with lupus. And that's not just for people with lupus, that can be for friends and family members as well. We have Take Charge, which is an educational series designed to help individuals take charge of their lupus. It occurs over the course of 8 weeks. People with lupus will receive a weekly email from our health educators, such as myself, with self-management tips and resources to empower them with the knowledge and skills to better manage lupus. We also have the National Health Educator Network, which I am a part of. And so that is for people, whether they've been living with lupus for 10 years, they've been newly diagnosed, a caregiver, or maybe somebody just thinks they have lupus and they, have some questions for the health educators. We're here to answer questions about lupus. We also have an online questionnaire where someone can go and see if their symptoms could be related to lupus and learn more about the importance of an early diagnosis. We also recently, I would say in the last year, launched what we call Inside Lupus Research, and that's a one-stop location for learning about the most important lupus research news that matters, whether it's early discoveries from clinical trials to new treatment breakthroughs. And in regards to research, we also have some other resources for that. We have a Center for Clinical Trials Education. We have an online database called Research for Me, which is a registry. And then we have a variety of local support and programs. And basically, we have local chapters or regional offices across the country that provide numerous different resources and events that people can get involved with. And you can always visit our website and search for the chapter office near you on our website. So now we can jump into what I assume most of you are here to hear about today, and that's preparing for your doctor's appointment, medical appointment. And we're going to focus on 5 main areas when it comes to preparing for an appointment. So first, we're going to talk about managing expectations. Perhaps you were recently diagnosed by your primary care provider and they've referred you to a specialist. It's important to see a specialist in a timely manner, but when you call, sometimes we might be shocked to learn that we might have to wait a little bit before we can get an appointment. Your first opportunity for a good visit to the doctor comes when you schedule your appointment. It's important to be understanding when scheduling your appointment. As I mentioned, it may take a few weeks to get an appointment. The staff definitely understands it's important for you to see the doctor and will help to get you scheduled as soon as possible. So most people with lupus will see a rheumatologist. And just to put appointment times, weeks or even months in perspective, there's a projected shortage of 2,500 rheumatologists by 2025. So that's only 5 years out, and we're looking at a pretty significant shortage of that particular specialist. So that can definitely impact those wait times to get appointments, especially as a new patient. You also want to make sure you take the time to talk to the staff member about why you're scheduling that visit so they can make sure they schedule enough time and can take care of your concerns during the visit. Sometimes if you have urgent concerns, it's really important to let them know because they might be able to work you in to the schedule. So they might squeeze you in, but you should probably be prepared to wait a little longer in the waiting room. You also should probably keep in mind that you may need multiple appointments, especially if you have a long list of concerns or if your doctor is working towards a diagnosis. Sometimes it's not as simple as one appointment and you get a diagnosis. You may need to have several visits. And when you can try to make your appointments at least a couple of weeks in advance as a new patient. I know that sometimes that wait time kind of dictates that anyways. But that will give you time to make sure you can prepare for that appointment. You can have your medical records sent from your other care providers so that your new doctor or new specialist has time to have all of your medical records and review your past medical history. You'll also want to keep a list of your current care providers. And when you're scheduling appointments, you can keep them on a calendar or use a calendar on your phone to remember your appointments. You can also put all of your doctors in your contact list. You'll want to include their name, specialty, and address. You'll be able to access their information no matter where you are. And it's a good way to remember what specialist it is and the doctor's name, especially if you have an appointment where you're filling out paperwork at a new doctor's office. That way you have that information pretty handy. You may also want to ask your doctor's office or health insurance provider if they have social workers or care coordinators. If they do have those available, they generally can help arrange and organize specialist appointments and help you prepare for your follow-up appointments or future consultations. So next, it's important to get organized. So I mentioned your medical history already, but the greatest part of your doctor's understanding of what's happening in your body will be based on your description of symptoms, both now and in the past. While the doctor also needs to examine you and look at results of laboratory and imaging tests, your personal history gives really valuable information. The more organized your medical history is, the easier it will be for your doctor to begin to consider possible reasons for your health complications. A really good way to do this is to keep a binder or folder with copies of your medical records. The binder will keep you organized and keep all of your important papers in one place so that you won't have to hunt down information before your upcoming appointment. You can also keep copies of your visit summaries, list of your current doctors if you're not keeping those in your phone, and it can also include your current medications in that binder as well. So you also want to keep a journal of your symptoms. It's important to track those symptoms. You can include a timeline and descriptions of your symptoms, including those that had disappeared. We also, if you visit our website, we have a checklist available on the National Resource Center on Lupus to help you keep track. And here is just a sample of what these different trackers look like. We have the Lupus checklist and the Lupus impact tracker. So even if you don't have lupus, these might be helpful for you to look at, just to give you an idea of things that you can track and keep a record of before going to the doctor. I also mentioned it's important to know your medications, also your dietary supplements. So your doctor needs to know what medications you're taking, including those prescribed by other doctors, and any dietary supplements. So those would be vitamins, minerals, or even any over-the-counter medications. So if you're taking ibuprofen or acetaminophen, it's important to tell your doctor if you're taking those on a regular basis. You can create a list, or you can bring all of your medications and dietary supplements, over-the-counter medications, like I said, both prescription and non-prescription, in the original containers to your medical appointment. Some doctors have a preference as to what they would like you to do. Some don't mind you writing them down, where others really do ask that you bring them in their original containers. And that helps the doctors understand the dosage you're taking, how often you're taking it, and the refill schedule. You should also tell them if you have any prescribed medications or dietary supplements that you're not taking for some reason, whether it be side effects, cost, or another reason. You should really tell your doctor that too. Any side effects you've noticed after taking a medication or product should also be reported. I know that some doctors' offices are able to pull your prescriptions up by checking your local pharmacies, and that's great as well. But sometimes they still want you to report what you're taking. Sometimes the pharmacy, they do have all those medications, but for some reason, maybe you stop taking something, or you bring those medications in the original bottle, and they can see that maybe you're not taking it as prescribed. Also, it's important to create a list of questions and concerns. A lot of times we get in front of the doctor and maybe we feel rushed, or we start talking about other things and we forget our questions. So prior to your visit, make a list of topics and questions you want to discuss with your care provider. I would recommend prioritizing the topics and questions that you feel are most important for your doctor to hear about. That way, if you don't get through the whole list in that appointment, you'll still have those most important questions to you addressed. And that way, your most important questions and concerns, you're getting those questions too. And not that your other questions aren't important, but perhaps they could wait till your next appointment. You also may want to anticipate what your doctor will ask and have answers to their questions prepared ahead of time. Excuse me. So a lot of these questions will mostly apply to symptoms. So think ahead about how you would answer them. And you can see some of these sample questions here, and you can always print these out from the handout so that you have them and you can think about them prior to your doctor's appointments. It's also really important to be proactive prior to your appointment. So you should understand what your disease or condition is before going to the doctor. If you have information about the disease, you will be better prepared for the appointment. Learning as much as you can help you recognize the different terms or tests the doctor may mention. It could also ease your anxiety about the diagnosis process. Different types of doctors or specialists include rheumatologists, dermatologists, cardiologists, nephrologists, gastroenterologists, pulmonologists, just to name a few. So if we have a better idea about what we suspect is causing our symptoms or have a good knowledge of what disease or condition we have, we'll understand what type of doctor can treat that disease. In the case of lupus, for example, most people with lupus will see a rheumatologist. If they have skin involvement, they may also see a dermatologist. And then depending on what body systems lupus affects, they may see some of those other specialists that I mentioned. And so it's not necessarily uncommon to have a team of doctors, a team of specialists that are managing one condition based on how it's affecting your body. So I know I keep going back to it, but we can use lupus as an example about being informed about a disease. So lupus is a chronic autoimmune disease that can damage any part of the body, such as the skin, joints, or even the organs. And so it's chronic, long-lasting, and not curable. However, it is treatable, and some people will go into remission and not have full symptoms, but that doesn't mean that the disease hasn't gone away. And lupus can develop in anyone, male or female, of any age, including children, teenagers, and adults. And lupus does mostly strike women of childbearing age. However, like I said, men, children, and teenagers can also develop lupus too. So if a doctor were to tell a man that, lupus is only for women and he doesn't have it, that's something to take into consideration, because you've done research and you realize that lupus can affect men as well. Lupus is pretty difficult because lupus is different for each person, and it is really just different for everyone, and you can see a whole host of different symptoms up here, and that's why it's so important to have a symptom tracker, because there are a variety of different symptoms that you could be experiencing, and like I said, it's different for each person. And those symptoms may increase during times of a flare, or they may even decrease or become inactive if someone's in remission. A lot of times that remission is usually medication-induced when it comes to lupus. So being familiar with how your disease is diagnosed can be really helpful. And in lupus, there's no single diagnostic test for lupus. The doctor will use a variety of tests to help them see the big picture of what's going on. The doctor will also take a look at medical history and symptoms, present and past. And even depending on the type of suspected organ involvement, they may want to do a tissue and biopsy. But if you weren't familiar with how lupus were diagnosed, you may think that there's just a single test that could be done, and you could be frustrated that the diagnosis process is taking multiple visits, when in reality that doctor is really kind of using all these different things as puzzle pieces, and they're putting those puzzle pieces together to see a big picture and to make that diagnosis. It just may not be as easy as diagnosing something like, let's say, diabetes, just because there is not one test to diagnose lupus. And as I mentioned, lupus is a disease that's known for being difficult to diagnose because the symptoms are different from person to person. They come and go, and a lot of them mimic other diseases. And so as I mentioned in the beginning, it can take 6 years to get a diagnosis. Even if it is suspected, it may take a while to get that official diagnosis. And so that diagnosis process, again, can be complex, and being familiar with the disease even if it's not lupus. I know I'm using that as an example, but just being familiar with whatever you have going on can help ease your anxieties and help the process. You may also want to research possible treatments so that you can have questions prepared ahead of time about that medication. Or if you have concerns about that medication, you may be able to ask for other alternatives because you've already done that research. We all know communication is key, I think, in life, not just for preparing for doctor's appointments, but in regards to appointments, it's, again, really important to bring your medical history, your prescription history, your symptom tracker, list of questions, all of that stuff that you work so hard to prepare before your appointment. I know I have been guilty of leaving everything that I prepared sitting on my desk. And a lot of times I do remember and I run back in and I grab it before I have to go out run out the door. But don't forget that. You've worked so hard to put all of that together, and you want to make sure you have it before you go to your appointment. All of it will help give your doctor a clear picture of what's happening with you. And to ensure the best management of your disease, it's essential to create a partnership with your healthcare team that includes clear communication. You want to make sure you tell your physician about any changes in your symptoms. This could be during your evaluation and when ordering tests. This can be done during your evaluation, and it can help your doctor when they order tests to ensure that they have a better understanding of what's going on with your health. And you want to make sure you tell your doctor everything that you've been doing that could affect your health. Remember, your appointment is confidential. Are you taking any over-the-counter medications for a different condition? Or are you on a diet? Do you have any stress at home? All of these things could impact your health, even if it's emotional stress, and especially diets. Think about if you cut something out of your diet, or I know there's a lot of different diets out there, but you're consuming something that you hadn't before, that may be impacting your symptoms. That could be causing changes in your blood work, whether it be good or bad. So it's important to share that with your doctor. And you'll also want to be as specific as possible about each symptom. Think about when it occurred and how it affected you. Also, don't be embarrassed. Your doctor has heard it all. If you're planning on discussing a personal topic, one way to avoid nerves is to practice what you plan on saying in advance. So remember, it's really important to share that information, even if it's embarrassing. It helps your doctor just form that overall picture and make sure it dictates what he or she does next for you. It's also a good idea to bring a paper and pen so you can take notes during the appointment. You may want to jot down some answers to the questions that you had. You could also ask the doctor, nurse, or pharmacist to write down instructions for you or to provide you with printed information about your condition, medications, or treatments. A lot of times they do have access to databases and they're able to give you that printout. I know that a lot of us have the internet readily available at our fingertips, but sometimes it's helpful to get that information while you're sitting there. You might be able to read over it while you're waiting, just so that you have it. And then it will also allow you to review that information after the visit in the calm of your own home. You can also share it with your friends, family, caregivers to help them understand how they can best support you in managing and treating the disease or condition that you have. Some doctors' visits may make you feel emotional, stressed, or even rushed. We know that sometimes we do feel like doctors are short on time due to appointment times, but it can be helpful to have a supportive family member or friend or even a caregiver accompany you to those appointments. They may be able to help you by taking notes or helping you recall what was said during the visit. I know that when you get a lot of information given to you at once, sometimes we may only remember bits and pieces. So if we have someone there with us they can help fill in those gaps that we don't remember, or even offer you reassurance if you think that you remember what was said to you, but you're not 100% sure. They can let you know that you are correct in your thinking. It's also really, really, really important to keep an open mind, and I can't stress that enough. If you go to a doctor's appointment with a fixed idea about what is wrong, and you and your doctor could possibly overlook key aspects of what could be causing the problem. So I know it's great to, a lot of times we get on the internet and we look up symptoms and we have an idea what's going on. And our intuition is typically pretty good, and we know our bodies better than anyone. But keep in mind that, symptoms may go across the continuum for different diseases. So it's really important to keep that open mind so that you can explore all options and get an accurate diagnosis or have an accurate treatment plan for you depending on what's going on. And finally, the end of your appointment is just as important as the beginning. So I know we talked about having a list of questions. Don't hesitate to let your doctor know about any questions or concerns you may have. It's best to be proactive in voicing your questions and concerns, as opposed to depending on your doctor to ask the right question. If you have any doubts about something your doctor has said, don't hesitate to continue asking questions until you feel satisfied with the answer. And again, before leaving, ask your doctor questions, such as some of the sample follow-up questions that I have listed here. And again, these slides are available in the handout, so you'll be able to print that and have these questions readily available for you. Before you leave, you can request a visit summary and follow-up summary with instructions. And so some doctors' offices automatically do this, but your doctor should go over what was discussed, decisions that were made about your treatment, if any, and any suggested changes to your medication or lifestyle. A lot of times doctors are hurrying, like I said, to stay on schedule, or perhaps they're already behind schedule, and they may accidentally forget to do this or not fully explain what you need to know. So you can remind your doctor to give you a brief verbal summary of what's been diagnosed or discussed, including your diagnosis, possibilities, or even diagnoses that were ruled out, symptoms to look for, activities to do or not to do, symptoms that may require immediate medical attention. They should also let you know of any kind of follow-up that you need to do, whether that be immediately, including forms or new lab tests. And they should also let you know about follow-up that you should do in the future, including when you should have your next appointment. It could be helpful to make your follow-up appointment, if you need one, in advance. So that ensures that you don't forget that you need a follow-up appointment. You can get your choice of date and time by scheduling ahead, and that makes sure that that you have that appointment time reserved for you. Because sometimes, like I said, for those specialists, they may book up far in advance, and you want to make sure that you're seen on that time schedule that the doctor is recommending. And I always like to mention self-advocacy, and I think it's really important that we all are advocates for ourselves. And so by advocating for ourselves, we enable our doctors to treat us effectively in order to give you the best care. Your doctors need as much information as possible about what you're feeling and noticing in your body. Empower your family members, friends, employer, if you're comfortable, and healthcare providers to give you the support you need. Most people want to help, but they can only do so if you're clear about what you need. And so ensure that your needs are being addressed. No one knows your body, your emotions, and your mental stressors as well as you do. And so I do have a link here that talks about being a self-advocate. I also have some additional resources here just to kind of give you some additional things to think about, lessons from healthcare advocates to improve your care experiences and getting the most out of your medical appointment. And so I know that a lot goes into preparing for your doctor's appointment. It's not only important to prepare for before your doctor's appointment, but be an active participant during and after your appointments so that you get the care that you need. Every doctor's appointment is your opportunity to explain and discuss your problems and concerns with someone whose job it is to listen and help. The better prepared you are for the appointment, the better you'll feel about the experience, and the closer you'll be to receiving an accurate and timely diagnosis or to developing a treatment plan that matches what you need. And so at that time, I'd like to thank you all for attending. And Carla, do we have any questions?
Ashley, thank you so much for that very thorough and informative presentation. What I like the most about Ashley, her style, and really this is sort of the style I would say for Lupus Foundation of America, is they can take something that may be a difficult or complicated topic or something that feels a little bit overwhelming and break it down into small bites so that and practical tips that we could actually incorporate into everyday's life. And to answer your question, Ashley, yes, we do have some questions coming in. It'll give me an opportunity to remind our audience that if you do have questions, again, you can submit them by typing them into the questions section of your GoToWebinar control panel. And before I get to those questions coming in for Ashley, I do want to remind you that NeedyMeds also is here as a source of support for you if you are having difficulty affording your healthcare expenses, which often can be an additional obstacle on your health journey. We do hope you reach out to us. Again, you can investigate our cost savings programs under that patient savings tab on the home page of our website. And what you're looking at on the screen now is some of our most popular and cost-effective ways to save on your healthcare expenses. And if you don't have access to the internet or you feel more comfortable speaking with a live person, don't hesitate to reach out to our expert call center counselors at 1-800-503-6897. And I absolutely will go ahead and put that contact information up as we're getting to those questions. One other resource I do want to take the time to mention that is not on your screen right now is the NeedyMeds app called Health Storylines. And the reason I'm bringing that up, and if you don't mind bearing with me, because I'm going to actually transition to the NeedyMeds website, because I really want to point this out. On the left-hand side, you'll see a link for Health Storylines. Health Storylines is a free self-care app. And yes, it does have the NeedyMeds drug discount card preloaded into it, which is great to know, but not the reason I'm bringing it up. I'm bringing it up because this self-care app makes it easy for you to track and manage your health conditions. It also makes it possible for you to manage the health conditions of your loved ones. For example, I have a mom who's struggling with dementia, and my sister and I every day at specified times have to call and remind her to take her medication. Well, that's an example of something that we can use this free self-care app to help us with. But the reason I wanted to bring it up is because Ashley talked about being mindful and tracking your symptoms and other things that are going on with your life so that you can accurately give your doctor a picture of what's going on at your next visit. So you may want to check out this free self-care app to help you to do that, and you can download it free on either Google Play or the App Store. And in fact, later this month, we actually have a NeedyMeds brief. I think it's on the 27th, next Monday, on how to make the most out of this app. So please do check that out, and thanks for indulging me as I talk about that, but I really did think it was important to bring up. With that, I'm going to, as promised, go ahead and leave up the contact information for both the Lupus Foundation of America as well as NeedyMeds. So Ashley, getting to those questions that are coming in, One, which I think is great and you probably get all the time, you talked about it just a bit, but maybe this will give you an opportunity to shed further light on this. And the question is, my provider is always in a rush during my appointment. And unfortunately, I think that's something we can all relate to. So, how do I get him or her to actually listen to my concerns?
Okay, that is a really good question. So again, I think it really goes back to that communication piece and really clearly communicating what you need when scheduling the appointment. And what I mean by that is different types of visits have an assigned amount of time for the provider per patient. So if we communicate our needs, they can schedule you for a longer appointment time. You may also want to ask if the doctor does any type of consultations in their office outside of the exam room, especially if you have a long list of topics to discuss. You may also want to consider asking the staff member that you're talking to if you're able to travel, if the doctor sees patients at different offices. Some offices operate a little bit differently. And so what I mean by that, I'll use a personal example. My one specialist, if I see him at their really busy office, I actually don't see the doctor there. I see his physician's assistant or nurse practitioner, whoever's assisting him at that time. However, if I see him at their office that they're only at half a day, once a week, I actually get to see the nurse practitioner and I get to see the doctor. And so it's just kind of how it works out. So again, stress those needs that you have, ask if they do consultation. And again, like I said, they might be a little bit different if you go to different offices. You might have to travel a little bit further or be a little bit more flexible with the day that you visit the doctor. But you may get more time with them depending on which office you see them at.
I think that's super helpful, and I'm so appreciative to audience members that participate because I always feel like if you have a question on your mind, chances are somebody else is thinking that same thing. And I think your response, Ashley, goes a long way into what you've been stressing throughout your presentation, which is really advocacy, which seems to be crucially important and something we can all practice more. And the more you practice it, the more you get comfortable with expressing your needs and hoping that you get people that will respond to those. Another question coming in is, when should I get a second opinion? That's a great question.
That is a great question. So I think it kind of goes back to advocacy, as you were mentioning, being a self-advocate. Only you can decide if you should get a second opinion, but there are some common reasons that a lot of people would get a second opinion for. So if you're having trouble talking to your doctor or you don't feel comfortable discussing sensitive topics, that might be a sign that you should get a second opinion and see if you can find a doctor that fits a little bit better with your style. So maybe you just aren't good at communicating with each other, or you just don't feel comfortable with them because you don't want to share those sensitive topics because of how they respond to you, or maybe you're just embarrassed. If your doctor is not a specialist for your condition, so I use this as an example, lupus, so perhaps your primary care doctor, your internal medicine doctor, they diagnose you with lupus. You most likely would like to get a second opinion by seeing a specialist for your condition. Also, you would want to explore if there are any other treatment options that your doctor has not provided. That would be another reason to get that second opinion. And also, depending on what you have going on treatment-wise or even condition-wise, if that treatment recommended is risky, or if you have something that involves surgery or could have lifelong consequences, it's usually recommended to get a second opinion. I know people that also will get a third opinion. They really want to weigh their options and see what the consensus is before proceeding with something that could have lifelong impacts, especially if there's surgery involved or very risky treatment involved or treatment with a lot of symptoms, side effects that come along with that treatment.
So helpful, and I really appreciate that you provided Ashley some benchmarks if something is a serious condition, if it could have lifelong effects. All of those are good reasons to seek a second opinion. But I really like how you stress maybe you just don't feel comfortable. Maybe you're not communicating well. And I think us all listening to how we feel when we're attempting to communicate with our healthcare professionals, again, goes back to the self advocacy, but I think is something to be mindful of. Certainly, I know I will do that moving forward because sometimes I dismiss how I feel, and I'm going to try and be mindful not to do that moving forward. I also, before we move on to another question that's coming in, I realized that in the previous question, somebody asked about how do I get my doctor to listen to my concerns? And Ashley had suggested you can always see if you can make an appointment at a different location if the doctor is more accessible there. And in this question, there's also a suggestion that if you're getting a second opinion, well, these two things I just realized as I was listening to this, they transportation may be involved. You may simply be going to the doctor that's most convenient because that's what you have access to. And I do want to point out on the slide that showed the most popular resources under that patient savings tab on needymeds.org. In the last year or so, we actually dedicated an entire section, added a new section to medical transportation because we recognize sometimes getting to and from a doctor's office or specialized facility can be a hardship. So if that is one of the barriers you're trying to overcome, check out again that patient savings tab and look for the section in the middle called medical transportation, or reach out to our call center counselors at that 800 number on the bottom of your screen. Ashley, another question coming in, and this is one actually that is coming up in my life, so I am eager to hear your response. The question is, how can I get names of my previous doctors so I can get my medical records? I've seen so many doctors over the years, I forget their names.
Okay, so definitely, I think that we can all relate to that. I know that I can as well. It, it doesn't help currently, but I think that is a good example of why it's so important to keep copies or records of your medical history. Remember, I talked about keeping that binder of those important documents, keeping a list of those doctors. So moving forward, I think that would help keep, that list of doctors. Now, for the ones that we've seen in the past and we haven't kept track of, if you can potentially remember what practice they were at, or maybe even a location, I know, for instance, I saw a doctor that was kind of near the mall. So if I looked on the map, I can most likely identify the practice that doctor was with, but I don't remember his name. You could always call and say that you were a previous patient, and you might be able to get information that way. Also, if you can remember who you've had health insurance with in the past, the carrier, you might be able to try calling their customer service number and asking for copies of your explanation of benefits, or sometimes we'll hear them called EOBs. And a lot of times those EOBs will include providers' names. Unfortunately, it's kind of hard to track them down without being able to remember their names, right? So, like I said, if you can potentially remember where they were located or the practice, maybe not the name specifically of the doctor, but the practice. And you can also try getting that information from your health insurance. Unfortunately, sometimes we might only be able to track back a couple of years, but at least we'll give your current doctor, at least a picture of what's been going on in recent years. And it's something for them to go on. But again, I think that especially as we move forward and I think as a population, we tend to see so many different specialties, and it's really important to keep copies of those records, or just keep a copy of previous physicians, care providers that you've seen in their specialty, so that you can always refer back to them if you need to.
Thank you so much, Ashley, and it's certainly suggestions I would not have thought of. So to our audience members, I just want to let you know that as per normal, I am going to keep the question segment of today's presentation brief. So if you did submit a question that we didn't get a chance to answer, we will follow up with you via email, or of course, you can reach out to Lupus, the Lupus Foundation of America, or NeedyMeds at the contact information on your screen. And we do hope here at NeedyMeds you join us for future webinars. And you can see what's upcoming under the Advocates tab. You'll see a section in the middle dedicated to webinars. And you can also check out, which may be easier, the calendar of events on the bottom right hand of the NeedyMeds homepage. With that, I want to extend a big thank you to the Lupus Foundation of America for their partnership, and of course to Ashley for taking time out of her busy schedule to share her expertise with the NeedyMeds audience. And to our audience, thank you so much for taking time out of your day to join us, and we do hope you stay in touch, again, by signing up for future webinars and certainly following us on social media. Thanks so much, everybody, and have a wonderful rest of your day.